So today we're going to talk a little bit about a blocked tear duct, otherwise known as dacrostenosis. Many babies are born with a blocked tear duct. It can happen right at birth, or it can happen several weeks later, or even we see it within the first month or two. Classic sign is that one of the eyes, sometimes both of the eyes, is a little bit more watery, and then you also get some associated crusting with that, kind of built up on the lashes a little bit, sometimes even a little bit more on the gooey side too. We don't want it to be terribly gooey. If there is a lot of drainage from that eye and it's getting thicker, greener, more yellow, then we want to address that in the office for sure. Blocked tear duct will resolve over time, although it can take quite a bit of time, sometimes several months. Best treatment options for a blocked tear duct are to kind of gently massage right on the inside of the eye. Make sure you wash your hands before so you have nice clean hands and short nails to do that. But you kind of massage right where that inner tear duct is. That helps, we hope, to kind of drain down through the nose and kind of open up that tear duct a little bit. A warm washcloth to kind of wipe away the drainage, kind of put some, warmth and moisture in that eye is good. If you are certain that there is no breast infection and you are breastfeeding, you can also put a couple drops of breast milk in your child's eye. It's very safe as long as there is, no concern of infection on the mom's side. That would only need to be done once or twice a day at most, and just when it's very gooey. You won't notice as much improvement if it's just a little bit watery, but when it gets gooey and more irritated, the breast milk does help a little bit. This can last, like I said, several months. If it is progressing into 9 months to a year, we typically will have the child go see the ophthalmologist, the eye doctor, to see if we can get some further treatment or possibly consider having what's called a tear duct probing, meaning a little surgery or procedure to open up that tear duct. Otherwise, it is a harmless condition as long as you don't get any infection from it. If you ever feel like the eyeball itself is too red, there's too much drainage coming from it, or it's just too irritated looking in general, then we want to see the child in the office to address and possibly treat for a little secondary infection if needed.